the somewhat coincidental timing of pandemic and VHS really trying to take off was a pretty amazing combination of stressors.
The camaraderie at the VTH is always really close. Like, we really are just a big family. But when you don't see your family all the time and you can't have those little water cooler conversations, it definitely makes it trickier.
I think I'm surprised always by how quickly we ramped back up to speed on the clinic floor and have been able to continue to see cases and help our patients. It didn't really seem like that was going to be very possible right at the beginning of things, but we're back.
We have an incredible group of people who are very, very willing to accept the challenges, and I think we're fortunate in the fact that we had opportunity to serve the community in a very tangible way.
COVID really brought everyone together because we were forced to kind of bundle up together under South Campus and come up with a plan for how to make it work through the pandemic.
It feels really good to get up and go up to work every day, and I was working some 11-hour days and skipping lunch breaks and really trying to wrangle our team and keep the morale high, and it was a lot, but it was also very worthwhile, and I feel like we accomplished a lot.
I've been incredibly inspired by the work of the entire VDL team. Everybody's come together to work together on a new project. Everyone's been supportive of it, and everybody's really been interested in helping serve our community in a time of crisis.
In a time when there was a lot of fear and unknown, there was just people who were willing to jump in and help, and it was really inspirational.
I think my technician team at the teaching hospital has inspired me the most. They are extraordinarily dedicated, and my job has certainly changed. I have to talk to owners on the phone, but they are in and out of curbside service. They are talking to worried owners out in the snow and the sun and the wind, and they're coming back and relaying that information to overly busy students, faculty, and clinicians. They've done an extraordinary job, and I think have kept the hospital running for the past 9-10 months.
What I learned this year is what I knew already, in that I'm surrounded by just quality, amazing individuals at every layer of the VTH.
The sense of community that CSU has, I really felt that from the beginning, that this isn't just a task that one person can do. Doing the COVID testing at the VDL, we really had to come together as a team.
The staff here just keep me coming to work. It gets me up in the morning and gets me to the VTH under all sorts of bizarre circumstances, because I know I get to work with them, and it's a joy.
By stepping up to do this coronavirus testing, even though we're an animal infectious disease lab, I really felt like that embodied the mission of the college, and I thought that that was exactly what we should have done, and we've been really successful at it.
Animals will get sick no matter what. They don't care about any world events or coronavirus or anything like that. They're going to get sick, they're going to get injured, and the veterinarian staff there and all of the staff knows that, and everybody's very passionate about it. So just the ability for everybody to continue showing up and say, yep, things are different, but we're going to get used to the face shields, and we're going to get used to the gowns and the weird spacing in the parking lot, and however we need to do it just to make sure the animals get care.